This session is explaining about the role of oxidative stress and antioxidant in liver steatosis. And then some people know that Mr. Florian is a nice guy and funny. And he said prevention, this is very important. This photo is from last year, SIPS 2023 in Panama. And he showed that really nice dancings. And then I also, thanks to that Professor Ferit Murad, unfortunately, he has passed away, and he found that the nitroglycerin vasodilator research and then nitric oxide is a key role in that relaxing factor in the circulation systems. And then after his founding, and Pfizer produced that same mechanism, and it's called the Viagra. And then oxidative stress that you cannot see, but if you cut the apple and stay in the air, it's oxidized and color changed. This phenomenon will be happen same thing in our body. And then here is saying reactive oxygen species pathology condition. ROS made a huge problem in the humans, inflammations, cancer, tissue injury, cancer therapy, hypertension, arteriosclerosis, and then the brain ischemia. And then to image what is the oxidative stress is, I would like to show that the two final product from oxidative stress. One is hypochlorous acid, and another one is hydrogen peroxide. As you know that hydrogen peroxide is a bleaching agent of the cross washings. And then if you touch this, immediately, turn to white and the inflammation starts. And then these two ingredients are produced in our body. For example, there is a white blood cell, neutrophils, and found that bacteria or virus, they eat in phagocyte, but cannot destroy that bacteria. They use that enzymes and the hypochlorous acid and the hydrogen peroxide. And that meaning is these oxidative stress final products helping our immune systems. However, you can imagine if in your bloodstreams high level of the bleaching agent, inflammation and happens in the whole body. And then the problem with the pharmaceutical product is just used only after diagnosis, not for the preventions. And then the single material only authorized as pharmaceutical. And then the multiple composition is not authorized. That's a single protein, single chemical, single enzyme, something like that. So that no multiple ingredient is not authorized. I developed that Twendee X. It consists with L-glutamine, vitamin C, L-cysteine, and cysteine, coenzyme Q10, succinic acid, fumaric acid, riboflavin, and niacin. And it is very, simple, 8 ingredients. However, ratio is very important to have a very strong antioxidant effects. And then also the safety test is passed through. I have lots of the patents. And then this slide showed blood level hydrogen peroxide was reduced after average 4 weeks intake of the Twendee X. You can see that almost all humans are reducing that oxidative stress, like average 30%. Many doctors try to found that something to reduce this oxidative stress, but using branched amino acid or something like that, only 7% after 6 months intakes. So background is fatty acid liver disease is a growing health problem associated with the increasing prevalence obesity and diabetes, elevated free fatty acid concentrations are linked with the onset of the peripheral and hepatic insulin resistance. And while their precise action in the liver remains unclear, it leads to liver steatosis. Although steatosis represents a reversible state of excess intra-hepatic lipid, it is also associated with increased susceptibility to oxidative stress and inflammation to trigger its progression to irreversible liver injury characterized by steatohepatitis and cirrhosis and hepato-carcinoma. And then background another background is the current molecular mechanism of this progression remain poorly understood. However, two-hit hypothesis represents the most commonly accepted model. In this model, steatosis represents the first hit sensitizing cells to subsequent stress with dysregulation of energy production and accumulation of the ROS. The second hit may take forms, including drugs, hypoxia, or cytokines, eventually leading to inflammations or steatohepatitis. Few in vitro models exist that can recapitulate this progression and its dynamics. And then I had a collaboration with a French company named ICDD. It is a professional company to measure that oxidative stress. And then the Twendee X is the potent antioxidant, and that is capable of reducing H2O2-induced and acetaldehyde-induced oxidative stress in native HepG2 cell lines. This is hepatic cancer cell lines. And we have established that the FFA-induced lipid accumulation in HepG2 cells, and as well as ascertained that the model induced significant oxidative stress and perturbed mitochondria bioenergetics. We also established the effect of Twendee X treatment in dose response in both preventive or curative treatment design, and further obtained evidence of the intracellular signaling pathway involved both in the FFA-induced oxidative stress and in Twendee X activity in regulating and normalizing this pathway. So this is a report from the ICDD. And then we do not know mechanism of antioxidant activity. There is several theories. ROS hit, and then Twendee X is which pathway is getting through. And then this is a prevention the lipid accumulation, TG and loss. And then there are lots of experiment. What is the systems behind? And then what's a certain thing is Twendee X reduces oxidative stress. You can see that vertical horizontal line, and then the left hand side is FFA-induced increase of the oxidative stress. And then if you put into that Twendee X in the systems, ROS is going down. And then what they found is inhibit RAF-MEK-ERK pathway. And then this finding is very unique because that many pharmaceutical companies try to find these mechanisms and in some drugs, but no one succeeded to inhibition of this pathway. And then the conclusion is Twendee X significantly modified this model by slowing FFA-induced increase in beta oxidation and in generating a mild uncoupling of the ETC. This engineering mitochondria from ATP productions. Twendee X reduced energy expenditure in FFA-induced HepG2 cells steatosis model. This mechanism of action is consistent with a strong reduction of FAA-induced increase in mitochondrial ROS production seen with Twendee X treatment. Twendee X also helps reduce FFA-induced oxidative stress by limiting cellular ROS accumulations and increasing ROS scavengers activity. Twendee X acted as an inhibitor of MEK1/2, blocking phosphorylation of ERK1/2 and down regulated both PPAR alpha and PPAR gamma downstream of the ERK and MAPK pathway. So these results suggest if the patient of liver steatosis keep taking the Twendee X, their risk going to that liver cirrhosis or cancer would be reduced. Thank you very much for that attention. Any questions? Yes, please.
Thank you for developing this amazing product. Can you share with us what was the methodology and the processes that you used to select the specific ingredients and specific proportions of each of these ingredients?
Yeah, actually, I was lucky because first I started to produce anti-alcohol supplement. And then we did lots of experiment. And then I found that these 8 ingredients have a strong reduced alcohol and then the reduced acetaldehyde. And then I tried to improve the effect for that alcohol. And one day I found this composition reduce blood glucose. And then I changed my intention to do that diabetes research because reducing glucose same time and reducing insulin, that is not depending on that insulin metabolisms. So that energy production increasing something like that. And then finally, I decided that the composition ratio most effective to reduce glucose. And then that meaning is mitochondrial energy production is maximized. That is a story of that why I choose and why I ratio to that this composition of the Twendee X. So it is just lucky things. Yep, you're welcome. Okay, so that we would like to move to the next presentation.